Antiarrhythmic agents. Question number 1. This drug is a class 1A antiarrhythmic drug. A. Sotalol, B. Propranolol, C. Verapamil, D. Quinidine. Quinidine is the answer since A and B are beta blockers while letter C is a calcium channel blocker. Question number 2. This drug is a class 1C antiarrhythmic drug. A. Flecainide, B. Sotalol, C. Propranolol, D. Verapamil. The answer is Flecainide. Since Verapamil is a calcium channel blocker, Propranolol is a class 2 antiarrhythmic drug, and Sotalol is a class 3 antiarrhythmic drug. Question number 3. This drug is a class 1B antiarrhythmic drug. A. Flecainide, B. Sotalol, C. Lidocaine, D. Verapamil. Correct answer is lidocaine, as it increases the electrical stimulation threshold of the ventricle, suppressing the automaticity of the conduction through the tissue. Question number 4. This drug is a class 2 antiarrhythmic drug. A. Flecainide, B. Propranolol, C. Lidocaine, D. Verapamil. Correct answer is propranolol, as it works by relaxing blood vessels and slowing heart rate to improve blood flow and decrease blood pressure. Question number 5. This drug is a class 3 antiarrhythmic drug. A. Flecainide, B. Sotalol, C. Lidocaine, D. Verapamil. Sotalol is the correct answer as it is used for the treatment of both atrial and ventricular arrhythmias. Question number 6. This drug prolongs repolarization. A. Flecainide, B. Sotalol, C. Lidocaine, D. Verapamil. The correct answer is Sotalol, since Sotalol significantly prolongs ventricular repolarization in the resting state. Question number 7. This drug is a class 4 antiarrhythmic drug. A. Flecainide, B. Sotalol, C. Lidocaine, D. Verapamil. Verapamil is the correct answer. Verapamil is a class of medications called calcium channel blockers. It works by relaxing the blood vessels so the heart does not have to pump as hard. Question number 8. This drug is used in treating supraventricular tachycardias. A. Digoxin, B. Dobutamine, C. Amrinone, D. Dopamine. Digoxin is the drug appropriate for treating supraventricular tachycardias, as it belongs to the group cardiac glycosides, used in treating heart failure due to systolic dysfunction and in supraventricular tachyarrhythmias. Question number 9. This drug is associated with torsades de pointes. A. Flecainide, B. Sotalol, C. Lidocaine, D. Verapamil. Sotalol is the correct answer as its QTC prolonging effect increases the risk for torsades de pointes and sudden cardiac death. Question number 10. This drug has beta-adrenergic blocking activity. A. Flecainide, B. Sotalol, C. Lidocaine, D. Verapamil. Sotalol is the correct answer as it is a non-cardioselective beta blocker that also possesses potassium channel blocker properties. Question 11. This drug is used in terminating atrial but not ventricular tachycardias. A. Flecainide, B. Sotalol, C. Lidocaine, D. Verapamil. Verapamil is the correct answer as it is classified as a calcium channel blocker and thus contraindicated in individuals with ventricular tachycardias. Calcium channel blockers can precipitate cardiac arrest in such patients. Question number 12. This is a drug of choice for acute treatment of ventricular tachycardias. A. Flecainide, B. Sotalol, C. Lidocaine, D. Verapamil. Lidocaine is the correct answer. Lidocaine administered intravenously has been highly effective in terminating ventricular premature beats and ventricular tachycardias by blocking cardiac sodium channels, shortening the action potential. Question 13. The calcium channel blockers have direct negative inotropic effects because they reduce the inward movement of calcium during action potential. This consideration is A. True, B. False, C. Incorrect question, D. None of the above. The answer is true. Calcium channel blockers have direct negative inotropic effects because they reduce the inward movement of calcium during the action potential. Question 14. Common unwanted effects of the dihydropyridines are due to vasodilation. It is considered as A. True, B. False, C. Incorrect question, D. None of the above. The answer is true, as dihydropyridines may amplify their own effects such as excessive vasodilation. Question 15. Verapamil is a more potent vasodilator than nifedipine. This statement is A. True, B. False, C. Incorrect question, D. None of the above. The correct answer is false. Verapamil is not a more potent vasodilator than nifedipine. Question 16. This drug is contraindicated in patients with moderate to severe heart failure. A. Nifedipine, B. Verapamil, C. Both of the above, D. None of the above. The correct answer is Verapamil. Being a calcium channel blocker, since they provide no functional or mortality benefit in treatment with Verapamil, can result in abrupt decompensation and development of overt pulmonary edema and hypotension. Question 17. This drug is an ineffective bronchodilator. A. Nifedipine, B. Verapamil, C. Both of the above, D. None of the above. None of the choices are correct, though nifedipine was found to enhance bronchodilator effect of salbutamol. Question 18. This drug is used intravenously to terminate supraventricular tachycardias. A. Nifedipine, B. Verapamil, C. Both of the above, D. None of the above. Verapamil is the correct answer, as it can decrease the rate of sinus node discharges and slow down AV node conduction while maintaining the normal function of his Purkinje fibers and ventricular myocardial cells. Thus, it is used to control atrial arrhythmias. Question 19. This drug has a little or no direct effect on chronotropy and dromotropy at normal doses. A. Nifedipine, C. Diltiazem, C. Verapamil, D. All of the above. The correct answer is nifedipine, as it is a calcium channel blocker which are known to have negative inotropic, chronotropic, and dromotropic effects. Question 20. Verapamil has a significant effect on automaticity in the SA node. A. True, B. False, C. Incorrect question, D. None of the above. The correct answer is true, as verapamil decreases the rate of spontaneous impulse initiation by the SA node. Question 21. This drug acts by inhibiting slow calcium channels in the SA and AV nodes. A. Quinidine, B. Adenosine, C. Flecainide, D. Diltiazem. The correct answer is diltiazem. It strongly depresses the AV node conduction, resulting in increased blood flow and decreased heart rate. At the same time, the drug slows the excitability of the SA node. Question 22. All of the following statements regarding verapamil are true except A. It blocks L-type calcium channels, B. It increases heart rate, C. It relaxes coronary arteries smooth muscle, D. It depresses cardiac contractility. The correct answer is B. Verapamil does not increase the heart rate as it slows the electrical activity in the heart to control the heart rate. Question number 23. All of the following calcium channel blockers are useful in the treatment of cardiac arrhythmias except A. Pepridil, B. Diltiazem, C. Verapamil, D. Nifedipine. The correct answer is nifedipine, as nifedipine has been associated with increased risk of myocardial infarction and mortality. Question number 24. All of the following are common adverse effects of calcium channel blockers except A. Skeletal muscle weakness, B. Dizziness, C. Headaches, D. Flushing. The correct answer is A. As skeletal muscles don't need extracellular calcium for muscle contractions. Question number 25. The adverse reactions characteristic for lidocaine. A. Agranulocytosis, leukopenia, B. Extrapyramidal disorders, C. Hypotension, paresthesias, convulsions, D. Bronchospasm and dyspepsia. The correct answer is C. Hypotension and paresthesias and convulsions, along with nausea and vomiting are common adverse effects and symptoms of lidocaine toxicity. Question 26. Which of these drugs are least likely to cause cardiac failure? A. Propanolol, B. Pindolol, C. Metoprolol, D. Ibuprofen. Pindolol is the correct answer as propanolol, ibuprofen, and metoprolol has increased chance of worsening symptoms as well as worsened heart failure. Question number 27. Major adverse effects of verapamil or diltiazem via IV administration. A. Diarrhea, B. Hypotension, C. Positive inotropism, or D. Stroke. Among the choices, the correct answer is hypotension, as it is a calcium channel blocker and works to relax your blood vessels and improve blood flow, which helps to lower blood pressure. Question 28. Same antiarrhythmic classification, disopyramide and A. Propranolol, B. Triamterene, C. Procainamide, D. Bretylium. The correct answer is procainamide. Disopyramide and procainamide along with quinidine belong to the class 1A drugs. Question 29. Most likely effective in treating supraventricular tachyarrhythmias. A. Flecainide, B. Esmolol, C. Lidocaine, D. Hydroxyzine. The correct answer is Esmolol. It is a FDA approved for short-term use in controlling supraventricular tachycardias, such as a rapid ventricular rate in patients with atrial fibrillation or atrial flutter. Question number 30. A reversible lupus erythematosus-like syndrome is most likely associated with this antiarrhythmic drug. A. Lidocaine, B. Adenosine, C. Carbamazepine, D. Procainamide. The answer is procainamide. Drugs such as procainamide, chlorpromazine, and quinidine cause the production of anti-nuclear antibodies, which leads to a reversible lupus erythematosus-like syndrome. Question 31. Antiarrhythmic drug most likely to cause seizures at high concentrations by direct CNS actions. A. Quinidine gluconate, B. Amiodarone, C. Lidocaine, D. Propanolol. Lidocaine is the correct answer. This is due to local anesthetics blocking sodium channels, which might lead to neurotoxicity. Lidocaine in particular has a concentration-dependent effect on seizures. Question number 32. Antiarrhythmic drugs acting at potassium channels. A. Adenosine, B. Sotalol, C. Diltiazem, D. Esmolol. The correct answer is Sotalol. is as it is both a potassium and a non-cardioselective beta blocker. Question 33. Synchronism, adverse effect associated with this antiarrhythmic drug. A. Procainamide, B. Verapamil, C. Quinidine gluconate, D. Flecainide. Correct answer is quinidine gluconate. Quinidine can cause synchronism symptoms to develop with as little as a single dose. Question 34. Antiarrhythmic drug administered IV typically used to suppress ventricular arrhythmias associated with acute myocardial infarction. A. Amiodarone, B. Metoprolol, C. Lidocaine, D. Phenytoin. The answer is lidocaine. It is the frequently used drug in the treatment of ventricular arrhythmias, particularly those associated with acute myocardial infarction. It has been shown to terminate ventricular tachycardia and suppress multiple ventricular extrasystoles. Question 35. Despite being a myocardial depressant, these antiarrhythmic drugs' anticholinergic properties facilitate AV nodal transmission. A. Phenytoin, B. Amiodarone, C. Adenosine, D. Quinidine gluconate. The correct answer is quinidine gluconate. Quinidine reduces automaticity and conduction velocity and increases refractoriness. Question 36. Changes in cardiac automaticity is most direct associated with changes in which slope of the myocardial action potential. A. Phase 4, B. Phase 1, C. Phase 3, D. Phase 2. The correct answer is Phase 4. Automaticity is the property of cardiac cells to generate spontaneous action potentials. Spontaneous activity is the result of diastolic depolarization caused by net inward current due to phase 4 of the action potential, which progressively brings the membrane potential to threshold. Question 37. Contraindicated in asthmatic patients, this antiarrhythmic drug blocks beta-1 receptors. A. Adenosine, B. Lidocaine, C. Procainamide, D. Propranolol. Correct answer is propranolol. Propranolol could precipitate severe bronchospasm in patients with asthma, especially at high doses. Question 38. Class 2 antiarrhythmic drug. A. Adenosine, B. Atropine, C. Esmolol, D. Lidocaine. Esmolol is the right answer. Esmolol is a short-acting cardioselective beta blocker, a class 2 antiarrhythmic agent. Question 39. Muscarinic receptor antagonists. This antiarrhythmic drug may be effective in managing bradycardia. A. Esmolol, B. Adenosine, C. Lidocaine, or D. Atropine. Atropine is the correct answer. It is a muscarinic receptor antagonist that is used to inhibit the effects of excessive vagal activation on the heart, which is manifested as sinus bradycardia and AV nodal block. Question number 40. Calcium channel blocker effective in treating supraventricular arrhythmias. A. Tocainide, B. Verapamil, C. Quinidine gluconate, or D. Brocainamide. Verapamil is the right answer. Verapamil is particularly suitable for the treatment of supraventricular tachycardias due to a circus movement, as calcium antagonism is likely to be most effective in the N region of the anterior ventricular node. Question number 41. Class 3 antiarrhythmic drug may be effective in treating ventricular arrhythmias. Prolonged phase 3 potassium channel blocker. A. Esmolol, B. Amiodarone, C. Lidocaine, or D. Propafenone. The correct answer is amiodarone. Amiodarone is a potent antiarrhythmic agent that is used to treat ventricular arrhythmias and atrial fibrillation. Question 42. Naturally occurring metabolites given by IV administration. This antiarrhythmic agent slows conduction through the AV node. A. Esmolol, B. Adenosine, C. Lidocaine, or D. Procainamide. Adenosine is the correct answer. It is a naturally occurring nucleoside that slows conduction through the AV node by opening acetylcholine-sensitive potassium channels and blocking calcium influx in the atrium and nodal tissues. Question 43. The digoxin is useful in treating high ventricular rates in patients with atrial fibrillation because A. Digoxin is a good drug for stopping atrial fibrillation. B. Digoxin increases cardiac contractility. C. Digoxin slows conduction through the AV node, therefore it reduces heart rate. Or D. Digoxin is metabolized in the liver. Correct answer is C. Due to its slowing conduction through the AV node, which reduces heart rate, it is useful in treating high ventricular rates in patients with atrial fibrillation. Question 44. Antiarrhythmic drug likely to increase heart rate. A. Tokainide, B. Verapamil, C. Quinidine gluconate, or D. Propranolol. Correct answer is quinidine gluconate. Quinidine significantly increased the heart rate at rest and at low levels of exercise. Question 45. Always administered by IV because of significant first pass effect, this antiarrhythmic drug suppresses ventricular arrhythmias associated with acute myocardial infarction. CNS side effects are prominent in overdosage. A. Verapamil, B. Propranolol, C. Lidocaine, or D. Amiodarone. The correct answer is lidocaine. In acute myocardial infarction, lidocaine is considered the drug of choice for treatment of malignant ventricular arrhythmias. Question 46. Class 1 antiarrhythmic similar to quinidine gluconate, greater antimuscarinic effects compared to quinidine, approved use for ventricular arrhythmias. A. Lidocaine, B. Procainamide, C. Disopyramide, or D. Mexiletine. Disopyramide is the right answer. Disopyramide is a new antiarrhythmic drug with a pharmacological profile of action similar to that of quinidine and procainamide. Question 47. Beta-adrenergic receptor blockers. A. Increased AV conduction time. B. Decreased AV nodal refractoriness. C. Both. D. Neither. The right answer is increased AV conduction time. Beta blockers cause the heart to beat more slowly and with less force, which lowers blood pressure. Question 48. Particularly effective in suppressing ventricular arrhythmias associated with digitalis toxicity. A. Lidocaine, B. Quinidine gluconate, C. Procainamide, or D. Phenytoin. Correct answer is phenytoin. Phenytoin has been shown to suppress digoxin-induced tachyarrhythmias. Question 49. Possesses anti-malarial, antipyretic properties. A. Flecainide, B. Esmolol, C. Quinidine gluconate, or D. Procainamide. The correct answer is quinidine gluconate. Quinidine blocks alpha-adrenergic receptors and muscarinic receptors. Quinidine has the same anti-malarial and antipyretic properties as quinine. In addition to its cardiologic indications, it is used for treatment of malaria and as an illicit abortifacient. Question 50. Amine-lidocaine analog, orally active, rarely used because of possibly fatal bone marrow aplasia and pulmonary fibrosis. A. Mexiletine, B. Tokainide, C. Quinidine gluconate, or D. Procainamide. Correct answer is Tokainide. Tokainide, a structural analog of lidocaine, it is a class 1B antiarrhythmic agent and is rarely used because it can cause bone marrow aplasias and pulmonary toxicities.